everyone, welcome to PODI 601, Musculoskeletal Podiatry. My name is Prue Molyneux and I'm your course coordinator. I'm also one of the program leaders for the podiatry program. I will start by giving you an introduction of this course, followed by your first lecture for week 1, which will cover terminology. I'll begin by covering the learning outcomes. All content assessed in this paper will be covered by these learning outcomes. Learning outcome 1, describe the structure and function of selected regions of the lower limb and trunk. Learning outcome 2, analyse normal and abnormal walking gait. Learning outcome 3, discuss selected lower limb assessments. Learning outcome 4, perform selected lower limb assessments. And learning outcome 5, interact professionally with others. The content of this course will cover anatomy of the foot, ankle, knee, hip, spine and trunk, the neurovascular supply of the lower limb, foot, ankle and lower limb biomechanics, clinical gait analysis, foot, ankle and lower limb assessments. In terms of the course structure and the learning and teaching strategies, this will consist of 2 weekly pre-recorded online lectures and 2 weekly online live tutorial sessions via Blackboard Collaborate. You are expected to engage in the lecture content before attending your scheduled Collaborate session. These Collaborate sessions will run every Monday and Tuesday from 10 AM to 12 PM, from week 1 to week 12. This will not run on week 7 due to your block course, which will be on campus. Your block course will run Monday, Tuesday, Thursday and Friday from 10 AM to 4 PM on week 7. As this course is predominantly online, it requires self-directed learning for you to stay on track and keep up with the course content. This course is a 30-point paper, therefore it is very content heavy and it is double the workload of your other courses this semester. It is crucial you keep up to date with the lectures and engage in the Collaborate sessions. Resources for this course include Blackboard. This is where you will find the teaching content, which includes pre-recorded lectures, the lecture slides, practical worksheets and assessment videos. Course resources is where you will find online textbooks, which are available for you for free. The main textbook I will refer to, especially in regards to its figures, is Gray's Anatomy for Students, the 4th edition. Field's Lower Limb Anatomy, Palpation and Surface Marking book is useful for labelling bony landmarks and soft tissue structures. It also has a list of questions at the end of each chapter. On Blackboard, you will also find a discussion forum. This is where you'll have the opportunity to ask questions on the content covered at the end of each week. Questions can be anonymous. Please don't be afraid to ask questions, as I'm sure if you are unsure of something, there's most likely a chance that someone else in the class is feeling the same way. If there are any common themes, I'll do my best to cover this content in the following tutorial. Dianatomy is a useful educational program. It consists of 2 main divisions, muscles and joints. The muscle animations show the attachment, position and action of each muscle. The joint animations demonstrate the joint movements and bring together the structural components. Additional animations accompany each muscle and joint to show special features or relationships. This link will give you free access. This course will be predominantly theory-based and the assessment will be focused around the theory. And in week 7, we will cover all the hands-on practical components of the paper, including surface anatomy and lower limb assessments. However, we will touch on the practical components as we work through each lecture. The theory behind these assessments will be assessed, but you will not be formally assessed on performing the assessments. The course involves 2 oral assessments. Oral Assessment 1 will be held in week 8. Assessment 1 will assess learning outcomes 1, 3, 4 and 5. It is 30 minutes and will be made up of 3 10-minute stations. The 3 stations include a discussion of the lower limb assessments and a description of the structure and function of the foot, ankle and lower limb. Oral Assessment 2 will be held in week 13. Assessment 2 will assess all learning outcomes 1 to 5. It is also 30 minutes, but it will be made up of 2 15-minute stations. The 2 stations include analysis of gait videos of a patient walking in both the frontal and sagittal plane. You will need to discuss the phases of gait, the gait observations, the structure and function of the lower limb throughout gait, and your approach for undertaking a gait assessment. Both of your oral assessments will be conducted via Microsoft Teams, so it will be done live online, so you can do this via distance. This course will also include 2 formative assessments for you to gain some feedback. So your first formative session will be held in week 7 at the end of your block course, and this will be peer assessed. Your second formative assessment will be in week 12, and we'll do this via distance. Your support networks for this paper include the library for IT support and library workshops. Student Hub is where you'll be directed for academic, personal and financial advice or support. And for this course, PODI 601, should you have any queries, please don't hesitate to contact me as your course coordinator. You'll find my contact details in the course guide on Blackboard. I look forward to engaging with you via Blackboard Collaborate and in the block course. Thank you.